Hello, my name's Dr. Simon Curtis, and today we're going to be looking at the distal phalanx of the horse. We're going to be looking at how it develops from fetus to maturity. So this is the leg of a foal, and let's just have a look at where the distal phalanx is within that leg. So we can see all the bones of the leg, and this is the fetlock here, so these are the phalanges, and the very last one is the distal phalanx, also sometimes called the coffin bone or P3. Even the old Latin name ospedis is still used scientifically. So it's lodged within the hoof capsule and it is suspended by the lamellae, which we can't see here because they're too small. While we're looking at this leg, take a look closely at the hoof wall here on this little neonate foal. It's a lot thinner distally at the bottom of the hoof than it is proximally just below the coronary band. And we're going to look at this in more detail in a later video. This is the distal phalanx of a mature horse, probably about 15 years of age. But we're not going to look at mature horse distal phalanx today. We're going to look at how that bone develops. So we're going to look at these 14 bones that I collected during my PhD. The distal phalanx of the horse in comparative anatomy is exactly the same as the last bone in our finger, which is also the distal phalanx, and of course we have our own little hoof around there. Not as well developed, I know, as the horse's hoof, but exactly the same anatomically. So let's have a look at this. This is the distal phalanx of a mature but still very young horse, and of course it has three surfaces. It has the parietal surface, to which the hoof wall is attached. It has the solear surface, to which there's an insertion of the deep digital flexor tendon, and it has the articular surface. Ignore the hole, this is a specimen and it was drilled there to attach it to another bone. And of course that other bone is the middle phalanx or second phalanx. So that articulates with this bone here. Additionally, we have three processes. We have the Palmar processes, sometimes called the wings of the pedal bone, and we have the Extensor process, which of course has attached to it the extensor tendon, which when the horse needs to extend its leg, it pulls on that, or the muscle further up in the leg pulls on that, and that extends the leg forwards. We can also see a couple of features on this bone. We can see where the collateral cartilage attaches, and of course it comes back in this rhomboid shape here. We can see the parietal groove, where a branch of the digital artery feeds blood to the back half of the distal phalanx. And we can see here that there's not really a crena formed here, but we can see these little foramen. The pedal bone, or distal phalanx, is just about the most compact bone in the horse's body. It needs to be, because it has to be remarkably strong to take a half-ton horse galloping at 45 miles an hour or jumping over a fence. So it's extraordinarily strong, but it's also filled with these arterial foramen, which are feeding the lamellae. And of course, if we look here at this surface, we can see those really large foramen there, which the digital artery terminates there and ends up inside the bone. So what happens to the blood then? Well, the blood actually comes out in branches, and if you see a venogram, you can see that, or an arteriogram. It then comes out into the circumflex artery, which runs around here, and of course that then feeds up in the front half of the distal phalanx, feeds up towards the lamellae this way. So all of these bones have pink there on the articular surface. Of quite clearly that's not natural. I'll tell you what happened. In my PhD, I had to number them. So I numbered them on the front and I numbered them there because mixing them up would have destroyed the study. Well, now they're a couple of years old, the damp has made it smudge all across it, so ignore the pink. These bones vary from 2 months before birth all the way through to 4 months after birth. There's lots of exciting things that are happening to them, and we're going to take a look at how that bone changes, not just in size but in shape also. So this is our first distal phalanx, 2 months before birth, and you can see firstly just how pointed it is. This is a right fore front, so this isn't a hind distal phalanx. Let's have another look at the back of it, or if we look sideways, you can see that it doesn't actually have an extensor process, nor does it have an articular process. So those haven't developed yet, even though it's only 2 months before birth. It's cartilage at this point, and in the process of boiling it out, we lost the cartilage. So you can see that it is quite convex in here, concave I should almost say as well. We can see the nutrient foramen here, but you especially see just how pointed this shape is. And it isn't that this distal phalanx has wings, because this would be cartilage as well. Only that's all that's left after boiling it out and having a look at it. Okay, now let's look at a distal phalanx at birth. And just to give you an idea of the change in size, a considerable amount of size growth in just 2 months. So unfortunately this foal died at birth, which is obviously the most dangerous day in any animal's life. So I was able to collect quite a few neonate distal phalanx. So let's have another look at this. It is still a very pointed shape, as you can see, and actually it still does not really have an an extensor process, and the articular surface still isn't fully formed. But it is just about ready to go. It still has this very pointed shape, although now it's quite wide, and perhaps not looking quite as concave as that the fetus that I showed you that was only 2 months of age. But just remember that this foal is going to stand up within 30 minutes of birth, and so this bone has to function as well as it does in a mature horse. It has to be able to support the whole weight of the horse through the hoof capsule. So this is our 4-month-old foal. So 4 months from birth, this is how the distal phalanx has developed. And you can see immediately that it is a more rounded shape. It's still not as rounded for a front distal phalanx as a mature horse is, but it's very much less pointed than those early bones that I showed you. We can see here, if I point there, we can see that the parietal notch is starting to appear, but it's still not fully formed, and of course there's still no wing to this distal phalanx, or no wings I should say. So at the age of 4 months, the distal phalanx is in full use. This is now a 200 to 250 kilo horse. It's getting a lot of stress through it, but it still doesn't have wings to the pedal bone. And of course those wings do develop throughout the life of the horse as a natural part of their maturity. This is the bone of a yearling, so probably 12 months to 18 months of age, and now we have something that's starting to look like the mature distal phalanx. We can see it does have a Palmar process, or a wing as it's called, I should say 2 wings, 2 Palmar process. And something a little bit unusual for a horse of this young is that actually the parietal groove is also already forming a sinus there, and we're going to look at that more when we look at mature horses. We can see the beginnings of almost side bone there. So this is part of the maturing process of the bone. We can see those sinus if we look carefully down there, and we can see just how big these foramen are, where the arteries enter from both sides and we have a terminal arch inside that bone. The other thing I wanted to draw your attention to was this notch in here, which is a crenna, and it's a naturally occurring phenomenon. You see it in lots of bones. The way to differentiate it from, shall we say, a keratoma or something that's been caused by an infection is to x-ray the other foot. And if they're both like that, then it is quite normal and natural. So we're going to go back to our 4-month-old and see if it's very similar to this. You can see here on this distal phalanx that there is no crenna. In other words, this outline is totally smooth, and although some mature horses don't have a crenna, I can assure you that no foals do have one. So in other words, it's another developmental phenomenon of the distal phalanx that at this point has not put in an appearance. Thanks for watching this video. If you have any questions, put them in the comments box below. If you liked the video, then please subscribe to our video channel, and also please share with friends.